Like the CDC just came out saying you don't necessarily need a booster shot. But I've heard people questioning, does it actually help against Delta? There's different variants. What are the effectiveness of these vaccines against the Delta variant?
Sure. So it looks like if you look at the actual studies, it looks like there is less protection with particularly the mRNA vaccines. Those are the ones we have the most evidence on. So the mRNA vaccines against Delta versus previous strains of the virus. And there are different reports, maybe 70% as opposed to 95, maybe 90% as opposed to 95. And that's at preventing severe disease or hospitalization. If you put that into perspective, for instance, flu vaccine every year, when we are telling people go get your flu vaccine and it keeps you from being in the hospital or dying of flu, we're jumping for joy when we see a 70% vaccine efficacy for flu vaccine every year. So these vaccines are still highly effective compared to what we normally see. As far as boosters, the question for boosters is, will it make a difference? There may be portions of the population where it would make a difference. For instance, there was a study that recently came out that showed that people who had solid organ transplants who were in a study, when they gave them a third dose, a significant number of them did actually develop immunity, whereas many of them did not with just 2 doses. However, if we look at the healthy population, giving someone a third dose doesn't really make a difference in their immune response. So I think what we're going to see is, particularly in relates to Delta, as we get more information, there may be a population that could benefit, but by and large, the vaccine is keeping most vaccinated people from winding up hospitalized with this disease. And that's exactly what we want a vaccine to do.
What about the variant makes it worse? Like you say, people are getting it who wouldn't necessarily. What about the variant?
Sure. So there are different proteins in the variant. So when viruses replicate, so they're not checked by an immune system or a medication, when they're allowed to replicate and pass from person to person, little errors in their genetic makeup can sometimes give them the ability to evade the immune system, or can give them the ability to maybe stick into the lungs better. There are a variety of different ways that can happen, but we know that this particular variant has extra things that are different than its original cousin or the original COVID that make that happen.
What do you have to give to people to reassure them that, there are cases where some people get the vaccine and they're still in the hospital? How do you reassure people that the vaccine is actually the great option?
Sure. So actually the vast majority of people that we've seen with what we call breakthrough disease, so meaning they're fully vaccinated, but they still get COVID. The vast majority of those people do not wind up in the hospital. Most of the people in our hospitals are people who are not fully vaccinated. And so we know that it works to prevent that. Is anything going to be 100%? No, it's absolutely not, but it's way better than 0%. So the other thing that we know is that even if you get COVID and you're asymptomatic, there are things that can happen to you, like long COVID, for example, long haul COVID. You can still have those symptoms, and getting vaccinated can prevent that as well. So what I would say to people is, if you look at the risk of getting COVID without a vaccine versus the risk of getting COVID with a vaccine, the risk of getting COVID with a vaccine is far and away safer for you than getting it without a vaccine.
So you kind of talked about people getting complacent, and some of that is included that people, receiving vaccine, it's getting more readily available, but people aren't necessarily getting those. So do you think that we have a plateau in getting vaccines?
A plateau compared to previous, Yes, I would say we're not seeing the excitement at being able to get your appointment for your vaccine as what we were seeing several months ago. However, we are still having people make appointments, and people walk in every time we have a vaccine clinic. We have 2 days a week at Gulf Coast. We have between I want to say I heard on a call this morning between 10 and 20 of people every day that walk in to get their first dose of vaccine. We still have, a couple of hundred each week who are coming in to get their first dose of vaccine. And so we're still seeing it. It's not in the high numbers that we were seeing before, but we are certainly still seeing it. And the other thing we're doing is we're really focusing on the young population. So for instance, our pediatric hospital is going out and setting up mobile vaccine clinics and is giving it to our younger kids. So hopefully we're going to reach that population too.
So Fox 4's viewing area goes into Hendry and Glade County, and they're seeing 23% vaccine rates and 33% vaccine rates, very low compared to some of the other counties. What are your message to those rural counties that aren't seeing those higher vaccination rates?
I think we've got to get the message to them, and we've got to make it easier for them to be able to get it, right? We've got to get to the areas where their population has the ability to get the vaccine. It can be hard, particularly if you have to travel 45 minutes to reach a place to get the vaccine and not interfere with your work life and your family life. And so I think we have to make it easier. And on us, that's a healthcare thing and a public health thing that we all need to help do. But I think we need to get that information out there too, and be sure that they know where they can get their vaccine, when they can get their vaccine. So I think it's an access issue.